Hello, my name is Michelle, and this is a tutorial on the anatomy and functionality of the knee joint. The knee joint is the largest and one of the most essential joints in the human body. Within the joint, there are three categories of joints based on mobility. Synarthrosis joints are immovable, amphiarthrosis joints perform slight movement, and diarthrosis joints are free moving. The knee joint is considered to be diarthrosis, and more specifically can be classified as a synovial joint. A synovial joint is where the articulating bones creating the joint are separated by a joint cavity. The cavity is filled with a thick fluid called synovial fluid to prevent friction within the joint. Before we go in depth about the functionality of the knee joint, let's discuss the anatomy of the knee. The knee joint is made up of two smaller joints, the tibiofemoral joint and the femoral patellar joint. The tibiofemoral joint is articulated by the medial and lateral condyles of the femur with the tibia. The femur patellar joint is articulated by the anterior and distal part of the femur with the patella. The ends of the femur and tibia are covered with a hyaline cartilage to aid in protection. In the tibiofemoral joint particularly, there lies articular discs, also known as menisci, on the medial and lateral sides of the intercondylar area of the tibia. They are C-shaped pads of fibrocartilage that minimize the distress on the femur and tibia by acting as shock absorbers. The joint cavity is particularly enclosed by the articular capsule, a two-layer capsule that consists of a fibrous outer layer and synovial membrane inner layer. The fibrous layer is made of dense, irregular connective tissue to aid in strength, whereas the synovial membrane layer is made of loose connective tissue and aid in the production of synovial fluid, which is a viscous fluid that aid in the lubrication of the joint. Within the knee joint, there are several sacs filled with synovial fluid, called bursae. They are located in areas between moving structures within the joint. There are four bursae that are located within the knee: suprapatella, prepatella, infrapatella, and semimembranosus. The suprapatellar bursae is located between the quadriceps femoris and the femur. The prepatellar bursa is found between the apex of the patella and the skin. The infrapatellar bursa is found between the tibia and patella ligament, which is known as the deep infrapatellar bursa, as well as between the patella ligament and the skin, which is also known as the superficial infrapatellar bursa. Lastly, the semimembranosus bursa is located between the semimembranosus muscle and the medial head of the gastrocnemius muscle on the posterior side of knee joint. As discussed before, these bursae are responsible for reducing the wear and tear on the moving structures within the joint. Another form of stability of the knee joint comes in the form of ligaments. Remember, ligaments are flexible, fibrous connective tissue that connects bone to bone. There are three main ligaments that contribute to the stability of the knee: patellar, collateral, and cruciate ligaments. I mentioned earlier that the joint cavity is particularly enclosed. The articular capsule is absent in the anterior portion of the knee joint. Because of this lack, the patellar ligament's function mirrors the function of the quadriceps femoris tendon for continued protection. The patellar ligament attaches from the distal end of the patella to the to the tibial tuberosity. The collateral ligaments are two strap-like structures that are extracapsular ligaments, meaning that they lie outside the capsule, that prevent rotation during extension of the knee by stabilizing the hinge motion. The tibial collateral ligament is found on the medial side of the joint and attaches to the medial epicondyle of the femur and to the medial surface of the tibia. On the other hand, the fibular collateral ligament is thinner and rounder than the tibial collateral ligament. It is located on the lateral side of the joint and attaches to the lateral epicondyle of the femur and the lateral surface of the fibular head. The cruciate ligaments are intracapsular ligaments, which means that they are located within the capsule that attach the femur to the tibia while forming a cross structure. Fun fact, the name cruciate derives from the Latin word cruci, meaning cross. The anterior cruciate ligament attaches the anterior intercondylar region of the tibia to the posterior region of the intercondylar fossa on the femur. The posterior cruciate ligament attaches the posterior intercondylar region of the tibia to the anterior region of the intercondylar fossa on the femur. Both anterior and posterior cruciate ligaments prevent any anterior or posterior displacement within the knee joint that could occur during the hyperextension or overflexion. Now that we covered the bulk of the anatomy of the knee joint, we can now discuss the movement and the muscles involved within the knee. The knee joint permits four core movements: flexion, extension, lateral rotation, and medial rotation. Flexion and extension are opposing angular movements that operate to cancel the movement of the other action. Flexion reduces the angle behind the knee joint, where extension increases the angle. During flexion, the hamstring muscles, which are bicep femoris, semitendinosus, and semimembranosus, gracilis, sartorius, and popliteus, are contracting to produce the action. On the other hand, the quadriceps femoris are responsible for extension and the leg extension of the leg at the knee. In regards to rotation, lateral and medial rotation only occurs when the knee is flexed. The hip joint will execute the rotation action if the knee is not flexed. For lateral rotation, the biceps femoris are responsible for that action. All of the muscles used for flexion, except for the biceps femoris, are responsible for medial rotation of the knee. That means only the semitendinosus, semimembranosus, gracilis, sartorius, and popliteus. Although the knee joint have various structures to protect and stabilize itself, many pathologies can still arise. Injuries to the knee joint can cause tears in ligaments and other structures within the knee. For example, a meniscal tear is where there is damage within the fibrocartilage, the meniscus, that cushions the knee. This can occur via high impact contact during sports, old age, or just by twisting your knee in an abnormal way. When there is a tear in your meniscus, if untreated, it can cause your knee to pop or lock up. Another condition that can occur is an ACL or PCL tear. ACL tears occur more often than PCL tears. By the ACL, anterior cruciate ligament, being a crucial and critical component for the stability of the knee, a tear in the ACL can lead to the knee giving out due to the severity of an ACL tear. Surgery is usually the treatment option. Whereas for PCL tears, posterior cruciate ligaments, physical therapy is also an option before surgery is needed. Another pathological condition of the knee joint is knee osteoarthritis. Knee osteoarthritis is the most common form of arthritis and occurs when the cartilage between the knee joint begins to degrade and wear down, leaving little to none lubrication between the femur, tibia, and patella. When this occurs, knee pain and swelling occurs. There are several treatment options, including lifestyle changes, physical therapy, pain relievers, steroid injections, and lastly, surgery. In closing, the knee joint is an important joint that contributes heavily to your everyday life. I hope this tutorial is helpful in learning the anatomy and functionality of the knee joint and some pathology that can negatively impact it. Thank you.